The current clinical approach to ALS has repeatedly proven that if you do nothing but watch and monitor the progression of the disease progresses and results in death. This is likely the #1 reason that there's not been progress on finding meaningful treatments for the disease, not to cure the disease and not to extend life expectancy with the disease. This is a problem of organizational structure and how the disease is approached, and organizational structure can be changed. The current organizational structure of how ALS is treated results in this kind of patient experience. They'll experience some kind of neurological issue, and they'll see the family physician, and they will be referred to a neurologist. At this point, the neurologist becomes the lead physician for patient care and recommendations. The neurologist will start on a diagnostic process, elimination of possible causes through testing, for example, EMG, nerve conduction test, and MRI. Early beliefs may or may not be shared with the patient. The neurologist will take a wait and see what happens over time approach with no treatment and no further search for other causes. So on the other side, you've got no treatment is being offered. The patient may be getting muscle spasms. That is not treated. There is no investigation of what could be causing the muscle spasms. Treatment or investigation of patient concerns leading to disease onset are not explored. The patient can go from the neurologist to the family doctor and gets a cyclic kind of thing where the family doctor is waiting for the neurologist to decide what to do. The neurologist will ultimately say, accept that you're dying and do nothing because it's a waste of time. The family doctor receives a report and refers back to the neurologist for patient care. Issues trying to get past the neurologist are accept that I'm an expert and that knowledge of your body or your past or any research you find will not make a difference in your prognosis. This is without evaluation of medical history or review of the research. Issues that patients have difficulty getting treated can be liver problems, stomach problems, hormone problems, infections. Connections to a range of specialists to help ALS patients is not happening, and it certainly is not happening early. ALS is defined as a neurodegenerative disease that affects nerves in the brain and spinal cord. But ALS patients often have liver problems, hormonal problems, kidney problems, stomach problems, infections, inflammation problems, absorption of nutrient problems, bowel problems, and eye problems. ALS patients are not sent to these specialists to determine if these other issues can be treated and affect the course of the disease. Let's look at some of the research that suggests ALS patients should automatically be referred to other specialists. This report, Platelet Serotonin Levels Predict Survival in ALS, shows that there is a definite link between the amount of serotonin a patient makes and their survival. This is particularly important for ALS patients with bulbar ALS. Now, if we look at that relationship, there is another report here, which is called Indigenous Bacteria from the Gut Microbia Hosts Serotonin Biosynthesis. This report shows that serotonin is made by enterochromaffin cells in the gastrointestinal tract and in the lungs. Gut microbia promotes serotonin biosynthesis. This relationship also affects gut mobility. So how many patients have a history of bowel mobility issues? This is a definite link. This is a GI specialist that would be looking at this kind of thing. There is another report, Serotonin, a link between disgust and immunity, that says that serotonin is also involved in innate immunity. So how does this affect the high level of infections around ALS patients? So ALS patients should be seeing specialists in immunity. Another report, Subtle Retinal Pathology in ALS, shows an unprecedented retinal damage pattern and suggests neurodegeneration beyond the motor system, and ALS patients are not being referred to eye specialists. VCStest.com offers a simple contrast test for biotoxins. If ALS patients were referred to eye doctors, maybe there's something in the eyes that can help point to the disease. This study, the complement factor C58 contributes to pathology in the rat model of ALS is showing that this metabolite is showing up on the spine of ALS patients, along with other metabolites called C3 and C3b. These metabolites are involved in what's known as innate immunity, or the complement system. Is this linked to the serotonin? We don't know. We don't have ALS patients being referred to immunologists to actually be looking at these issues. This study, complement control protein factor H, the good, the bad, and the adequate, shows that factor H function requires C3b fragments necessary for it to work. C3b is one of the complement metabolites showing up on the spines of ALS patients. So factor H has some kind of relationship, and we need immunologists to be looking at this to help ALS patients. Factor H is one of the regulators of the complement system, which is your innate immunity. Now, when you look closer at factor H, you'll find that many microbes have factor H evasion strategies where they bind onto factor H binding sites. So if you look at it, mold and Lyme and Candida are very, very common pathogens that bind onto factor H binding sites. And we don't know how this affects disease progression for ALS patients because we don't have immunologists looking at ALS patients. We don't have automatic looking for these kinds of infections to be treated in ALS patients. In conclusion, the structural organization we need changed is when a patient first notices that neurological problem, they're referred to a functional medicine doctor. When they get there, they get a detailed medical history, all of their information, and from there they get referred to the specialist for the diagnostic testing. They get detailed testing on liver, kidney, thyroid, lungs, eyes, pathogens, glands for baseline data, and to look for any problems that need treating. They get referred to specialists unique to the patient's history for treatments of all suspected elements. Using this approach, doctors with different specialties add their expertise to extending patients' lives and more connections to what can be done or made, and patients are given hope, which in itself is healing.